12:34 on this Monday, and for your health this afternoon, we're nearing the end of July and pretty soon kids will be heading back to school. It is important they're up to date on all their vaccinations. Covering Allegheny County, Pittsburgh's Action News 4 reporter Yasmin Rodriguez is answering some questions.
Late summer is when the kids start returning back to school. Parents are checking off all those back to school lists with supplies and after school activities. Something parents might not think of is back to school vaccinations.
School is also a time when there's lots of social interaction. People who haven't been interacting with each other are now thrown together in sometimes poorly ventilated rooms, so they do exchange a lot of viruses.
And with the seemingly constant change of recommendations when it comes to child immunizations, we spoke to a Pittsburgh-based infectious disease doctor who's also a senior scholar at the Johns Hopkins Center for Health Security. Dr. Amesh Adalja says he understands the uncertainty parents may have surrounding vaccines when it comes to new recommendations, but he notes, especially for children, they are a necessity.
Children are exposed to a lot more in terms of infectious disease because they have so much more social interaction than adults. I think about new vaccines the same way I think about a new iPhone, that people should be really clamoring for this technology because it's a way that we exist in a world where there's lots of infectious disease threats.
But what are these new recommendations and changes, and who's making them? Well, you've heard of the Centers for Disease Control, or the CDC, but before them comes the Advisory Committee on Immunization Practices, or ACIP. They develop recommendations on how to use vaccines. Those recommendations become official CDC policy once adopted by the CDC's director.
It's a bad precedent when ACIP, the big advisory committee, is making decisions not based on science, but based on the political mood of the moment.
As of June 2025, U.S. Health Secretary Robert F. Kennedy Jr.'s newly appointed ACIP upheld recommendations for the fall flu vaccination to be administered to anyone 6 months and older, as long as the shots are completely mercury-free. That term, mercury-free, is what's sparking debate after the committee introduced the new recommendation.
The only flu vaccines that people get, for the most part, are mercury-free. Only about 4% of the flu vaccines given in the United States come from a vial that has that mercury preservative.
That preservative is called thimerosal. It's used to protect vaccines free from germs. Dr. Adalja says when you get a vaccine and more than one dose is taken from a single vial, thimerosal would be added. What it doesn't do is make the vaccine stronger.
Thimerosal has been tested in dozens and dozens of studies, and there's been no linkage with any type of side effect, any type of neurodevelopmental behavior.
And he says the type of mercury found in thimerosal doesn't accumulate in your body. But the flu vaccine isn't the only recommended vaccine kids should be up to date on before heading back to school. Here in Pennsylvania, children should be up to date on the following vaccines: Tdap, polio, MMR, hepatitis B, chickenpox, and additional doses of those vaccines throughout the years. Something we've heard more of lately is that MMR vaccine. That protects against measles, mumps, and rubella. Measles is something the public has heard more often. Secretary Kennedy, back in April of this year, called for people to get the measles vaccine, while at the same time claiming it hadn't been safety tested. But in that same month, after visiting Texas, a state that saw a deadly measles outbreak this year, Secretary Kennedy posting to X, saying in part, quote, "The most effective way to prevent the spread of measles is the MMR vaccine." As of July 8th of this year, 1,288 confirmed cases of measles were reported in 39 states. Pennsylvania is one of those states.
A lot of us don't remember a time when our classmates had measles or were hospitalized for measles. And that maybe has gotten parents to think, well, maybe these aren't that valuable in 2025, but they are. Measles is the most contagious disease that we know. One person with measles can infect 10 or 15 other people. It spreads through the air. And measles is not a benign infection. 1 in 5 people get hospitalized, 1 in 20 get pneumonia, and 1 in 1,000 might die from measles.
Dr. Adalja says if your child is fully vaccinated against measles and there is a measles exposure in the classroom, to rest assured that your child probably won't contract the virus. He says to not panic going back to school and continue to find trusted resources. He recommends the American Academy of Pediatrics or your state or county health department. Yasmin Rodriguez, Pittsburgh's Action News 4.